This video contains graphic images of medical procedures and human organs. Viewer discretion is advised.
Shannon had called us that we received this letter from Gift of Hope. Dear Grobmeyer family, please accept our deepest sympathies on the recent passing of your child. The decision to give the gift of hope through donation are a lasting legacy and a testament to Madeline's beautiful spirit. Madeline saved 3 lives through organ donation. Her heart and liver went to a woman in her 30s. Her right kidney went to a woman in her 20s. Her left kidney went to a woman in her 70s. Madeline's left and right lungs were recovered for use in medical education and research and will help scientists unlock the complexities of disease processes and find life-saving cures in the future. We hope it brings you comfort to know that Madeline's eye tissue has provided the gift of sight to a child from Lansing, Michigan. We hope that you and your family will be comforted by your decision to help others and inspire compassion through eye donation. Thank you for making miracles possible. With warmest regards, your Donor Family Services team. Knowing that it affected a child, there's so many more years and things that this child's gonna see because of Maddie.
And we've actually found out that the child was just 2 years old when she got the cornea transplant. That was the one thing that we paused on with Maddie, was her eyes. It was good to know that, reaffirmed that we made the right decision.
There are a lot of different people that make donation happen, from the paramedics and EMTs that get the 911 call, to the ER and ICU nurses and physicians that try to save the donor's life, to the social workers and chaplains that help the donor family through their grief, to the medical examiners and coroners that still have to investigate deaths and work closely with us to make sure that donation can still happen.
Even at Gift of Hope, there are so many different roles here that you don't think about. Like, obviously we have HR people, we have people that work in the call center that take in the calls for the referrals, and we have the people that do my job, but specifically for tissue recovery techs, you have transportation people, everyone from all different walks of life and probably all different degrees can work here. But I think the most important thing is just having a passion for doing this work.
The longevity of organ transplant really depends, and you probably have heard, organ rejection that happens within minutes, or an organ transplant that lasted, for 50 years. Okay, so it depends on the level of matching, and also it depends a lot on the recipient side, their underlying diseases, or any comorbidities, things like that, and are they compliant with immunosuppression? What we found that a lot of younger adults, when they receive a transplant, they feel fine, they stop taking immunosuppression, then when the organs start rejecting. So if you look at actually matching, the more match between the donor and recipient, the longer the organ will survive. So if you compare a recipient and an organ donor, if they are completely mismatched, they are not matched at all, just say that the kidney lasted 5 years, okay, as compared to the exact same pair but with complete matched HLA, the kidney can last 8 to 10 years, so a few years more.
HLA stands for Human Leukocyte Antigens. HLA are proteins or markers on most cells in your body that your immune system uses to see which cells belong in your body and which ones do not.
My name is Carmel Medard. I'm a registered nurse. I work at Northwestern Memorial Hospital. I've been a nurse for 40 years. I love bedside nursing. I've tried management, I've tried a lot of different things, but I'm very hands-on. I love the people, I love the patient, and I love what I do. Once the patient comes in post-transplant, it's one nurse with one patient, and we monitor them closely for the 12 hours that include their vital signs, their medications. We make sure that everything is taken care of. they do require to be on immunosuppressions for the rest of their lives. The medication they need is to help them prevent from rejecting the organ.
According to the National Kidney Association, when someone gets an organ transplant, the body sees the new organ as being a foreign body and will try to destroy it. Immunosuppressants, or anti-rejection medicines, lower the body's ability to reject a transplanted organ. There are two types of immunosuppressants. Induction drugs are very powerful and are used at the time of transplant. Maintenance drugs are anti-rejection medications used for the rest of the transplant recipient's life. The long-term goal is to find a balance of medications that prevent rejections while minimizing side effects.
And we also have to remind them that they do have to continue to take their medication even if they feel better. And some patients that have been on blood pressure medications for a very long time, all of a sudden no longer need it, and they can't deal with that. They can still continue to live a great life, but they have to pay attention to things that normally we would, like our blood pressure, our blood sugars.
There is an interplay between the organ that's donated and the recipient. So lots of things come into play. For kidney transplant, living donation, the half-life, meaning half of them last longer, half of them last shorter, can be as long as 15 years. I actually have patients, though, who still have their original kidney 20 plus years later, which is an amazing thing, and they still have a normal creatinine. I actually have a student that I'm really proud of that got a kidney transplant when she was, I believe, 10 years old. Or maybe even younger. But she's gone on to be a transplant surgeon. One thing about transplant is that I've got patients that I've kept in touch with for many years that I still continue to see about once a year just to make sure everything's going on. And you know, they're part of your extended family. You know, I've seen babies born, I've seen grandbabies born, and it's an amazing privilege to be a part of that, to be able to say I contributed in some small fashion to the ability for that person to go on and live their life.
There's been a lot of advancements in organ donation over the years, so it's a relatively new field of medicine. The first successful kidney transplant was done in 1954. The anti-rejection meds played a huge role in the 80s of people not rejecting the organ within weeks of transplant. And so then these organs were lasting decades. And now we have volunteers who are recipients that come back and their transplant was 25 years ago. And that's really due to cyclosporin and all the new anti-rejection meds that are coming out.
There have been a lot of advancements in organ and tissue donation over the years. Now we have very good organ preservation solutions that allow us to assess organs. I kind of call them organ resuscitation solutions themselves, because sometimes there are organs that we're not sure that we could use. The ability, for instance, to pump kidneys, to put them on a little machine and pump some preservative through them to see if the kidneys are they really going to work? And then we actually transplant them and they go on to function for quite a long time. There are things that we can do for the patients pre-op in terms of better physical therapy and occupational therapy, so when they come to transplant, they're actually stronger when they actually go through the surgery. So there have been a lot of advances in how we look at the patient as a whole. So there have been advances in organ preservation techniques. There have certainly been advances in surgical techniques. There have been advances in medications so that patients take medications with far fewer side effects. We have medications that we can use together and look at their levels so that we can tailor the medications a little bit better to the patient so they don't suffer as many side effects and yet still don't have any rejection episodes. So all those kinds of things are important.
We use a lot of DNA technology to identify the donor type and the recipient type. The DNA sequencing takes longer as opposed to us. We do the HLA typing within 2 hours, but if you go into DNA sequencing, it takes up to 2 days to do that. But that's one of the main advancement in the last few years. It's getting faster and faster, for sure.
There's a lot of IT, really. There are extensive computer programs that really do all the matching. You know, if you want to get into the medical field, you can actually go into IT.
According to Hopkins Medicine, traditionally, donated organs are placed on ice until they are transplanted into a recipient. But with ex vivo perfusion, a machine keeps organs preserved and ready for transplantation by continuously pumping fluid through them.
When I started at Gift of Hope 10 years ago, we had rule-out criteria that we would never do now just because of the perfusion pumps. Before donation after circulatory death, the heart was an automatic rule-out because the heart would stop and it would become ischemic.
According to Donate Life America and UC Davis Health, after doctors have made every effort to save the patient's life after a devastating injury or medical trauma, brain death or cardiac death may be declared. Brain death is only declared after specialized tests have been performed to confirm that there is no brain or brainstem activity. If the patient does not meet the criteria for brain death, but has had irreversible brain damage and is unable to breathe without the aid of a ventilator, and after the family decides to withdraw life support, cardiac death is declared. In both cases, organ and tissue donation is possible, though the process looks different for a donor who passes from cardiac death.
Now we can put that heart on a perfusion pump and it has the same outcomes as a brain dead heart. And that was something that I wouldn't even have dreamed of 10 years ago that could happen. So every couple of years, huge new advancements come in the organ donation field just because it's so new.